What exactly is gallstone disease? It's very commonly seen in women, especially after having children. Some patients may require just medications, whereas some patients would need a surgical procedure. Hello, I'm Dr. Erbaz Momin. I'm a surgeon attached to apollospectra hospital. Upper GI is my specialty, and today we are going to talk about gallstone disease. What exactly is gallstone disease? A lot of people have this problem of indigestion or food not being digested, or fullness after having food. Sometimes they puke and they even get pain in the upper abdomen on the right side. This problem is very common. It's very commonly seen in women, especially after having children, and it is very commonly ignored. So how do we diagnose this, or how do we treat this? That's a very common thing which a lot of people might be interested in knowing. So mostly we are able to get an idea about this problem once we see a patient. Once we have a detailed examination is usually able to tell us some idea that the patient may be having this problem, and a sonography is usually able to confirm this problem. On sonography you may notice that you have gallstones in your gallbladder. The treatment is pretty straightforward, simple. Some patients may require just medications, whereas some patients would need a surgical procedure. It's a very simple surgical procedure. You do a procedure by laparoscopy or a minimal access method. The patient may be able to go home the same day or the next day after the procedure, and they are usually able to get back to work quite early. The question is, why couldn't you just prolong this? The problem is, sometimes these patients or some of these patients may get complications which may even be jaundice, and sometimes they may even land up in an ICU with these complications. So that's the reason you shouldn't ignore it and seek treatment when you are not really having a problem, rather than delaying it till the time you really have a major issue to deal with. Thank you.